Diabetes mellitus is a serious health condition that affects millions of people worldwide. It's a group of metabolic disorders that result in high blood sugar levels, either because the body doesn't produce enough insulin or because it can't use the insulin it produces effectively. This imbalance can lead to episodes of dangerously high or low blood sugar, which, if left unmanaged, can be life-threatening. But before we dive into complications of diabetes, don't forget to subscribe our channel, and give this video a like. When diabetes isn't controlled, it can lead to a wide range of complications, including blindness, caused by damage to the retina, retinopathy; kidney failure, nephropathy, which can require dialysis or kidney transplant; nerve damage, neuropathy, often starting with tingling or numbness in the feet and hands; heart disease and stroke, due to the buildup of plaque in arteries, atherosclerosis; gangrene and coronary artery disease, which can result in amputation or death. These complications make diabetes much more than just a blood sugar problem. It's a condition that can impact almost every major system in the body. Diabetes is a global health crisis. In 2014, an estimated 380 million people were living with diabetes. By 2035, that number is expected to soar to 592 million, with about 80% of cases occurring in low- and middle-income countries. In the United States, the numbers are just as alarming. Between 1999 and 2002, 9.3% of the population had diabetes, and 30% of these cases went undiagnosed. By 2006, the prevalence had climbed to 12.9%, affecting around 40 million Americans. China and India, two of the world's most populous countries, have the largest diabetic populations. In China alone, there were an estimated 113.9 million people with diabetes by 2010. Even more concerning is the high percentage of people with undiagnosed diabetes. Globally, it's estimated that 50% of people with diabetes don't even know they have it. In the US, this number has improved, with the proportion of undiagnosed cases dropping to 11% between 2006 and 2010, but it still remains a significant challenge. Certain groups are at higher risk for developing diabetes, including older adults. About half of all diabetes cases occur in people over the age of 55. Ethnic minorities, Hispanics, blacks, and whites all have a higher risk of developing diabetes, particularly after the age of 65. These risk factors highlight the importance of regular screening, particularly for those in high-risk groups. The classification of diabetes has evolved significantly over time. First, we have historical classification of diabetes. Originally, diabetes was diagnosed using the oral glucose tolerance test, OGTT. If a person's blood sugar levels were more than 2 standard deviations above the average of healthy individuals, they were considered diabetic. This test often identified people with high blood sugar levels shortly after consuming glucose, even if their fasting blood sugar was normal. These individuals were thought to have early or mild diabetes. By 1975, over half of people aged 60 and older were classified as having abnormal glucose tolerance. However, most of these individuals with mild glucose intolerance did not go on to develop full-blown diabetes within the next 10 years, and many even returned to normal glucose tolerance. Interestingly, while most populations showed a unimodal, log-normal distribution of blood sugar levels, certain ethnic groups, such as the Pima Indians and Nauruans, displayed a bimodal distribution, highlighting unique variations in glucose tolerance. In populations with a high prevalence of diabetes, the best way to differentiate between normal and diabetic individuals was based on fasting glucose levels of 140 mg per deciliter, 7.8 millimoles per liter, or glucose levels above 200 mg per deciliter, 11.1 millimoles per liter, 2 hours after consuming a glucose load. Microvascular complications, such as damage to the eyes or kidneys, were rare in those whose glucose levels were below these thresholds. In 1979, a major change occurred when a workgroup recognized 2 main types of diabetes, type 1, insulin-dependent, and type 2, non-insulin-dependent. This was a significant shift away from the previous terms juvenile onset and adult onset. Further changes came in 1997, when the American Diabetes Association, ADA, replaced the terms insulin-dependent and non-insulin-dependent with type 1 and type 2 diabetes, removing outdated categories like previous abnormality of glucose tolerance. Let's talk more about type 1 diabetes, the less common form of diabetes, accounting for only 5 to 10% of all diabetes cases. What makes type 1 diabetes stand out is the sudden onset of symptoms, which can include frequent urination, polyuria, excessive thirst, polydipsia, rapid weight loss. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the beta cells in the pancreas, which are responsible for producing insulin. Because of this, people with type 1 diabetes rely on insulin injections to survive and prevent dangerous complications like ketosis, a potentially life-threatening condition where the body breaks down fat too quickly. Most people with type 1 diabetes also have antibodies that show an autoimmune process is at play, although some individuals may not have any such evidence. While type 1 diabetes often develops in childhood or adolescence, it can actually occur at any age. Importantly, the age of onset does not affect the diagnosis. Type 1 diabetes can appear in both children and adults alike. Once diagnosed, individuals with type 1 diabetes will need insulin for the rest of their lives. Managing the condition requires ongoing treatment and careful attention to avoid complications and maintain overall health. Type 2 diabetes mellitus is by far the most common form of diabetes, accounting for approximately 90% of all cases. But unlike type 1, the symptoms of type 2 diabetes can often be subtle or even go unnoticed, making it a tricky condition to identify early. People with type 2 diabetes may not experience any noticeable symptoms, or if they do, these symptoms can be mild and develop gradually over time. The body's ability to use insulin effectively is impaired, even if insulin levels are normal, low, or high. This dysfunction prevents the body from regulating blood sugar properly. A significant number of people with type 2 diabetes are also overweight or obese, and studies show that losing weight can improve blood sugar control and overall health. Managing type 2 diabetes varies from person to person. While some individuals can manage their condition through diet and exercise, others may need to take oral medications or even insulin to control their blood sugar levels. Though more common in people over 40, type 2 diabetes is increasingly being diagnosed in younger individuals, including children and adolescents. In some countries, like Japan, type 2 diabetes has now become more common in children than type 1 diabetes. Not all diabetes cases are classified simply as type 1 or type 2. Some people develop diabetes due to specific genetic defects or other underlying conditions. For example, pancreatic diseases like cystic fibrosis can lead to diabetes. Hormonal imbalances, such as those caused by Cushing's syndrome or acromegaly, can trigger diabetes. Certain medications, including steroids or some antibiotics, can increase the risk of developing diabetes. Infections, like pancreatitis, can damage the pancreas and impair insulin production. Certain genetic conditions, such as Down syndrome or Klinefelter syndrome, also raise the risk of developing diabetes. Diagnosing diabetes due to these specific causes can be more complex, often requiring specialized tests and thorough evaluations. Treatment will also vary depending on the underlying cause and may involve a combination of medications, lifestyle changes, or other interventions. Regular monitoring is essential to managing all forms of diabetes effectively. This includes keeping track of blood sugar levels and other health metrics to prevent complications and ensure good long-term health. Gestational diabetes mellitus, GDM, is a type of diabetes that specifically occurs during pregnancy. Unlike pre-existing diabetes, which women may already have before becoming pregnant, GDM develops when a woman experiences high blood sugar levels during her pregnancy. GDM is different from pre-existing diabetes because it only emerges during pregnancy. Depending on the population and diagnostic methods used, the frequency of GDM can range from less than 1% to as high as 28% of pregnancies. In the United States, GDM occurs in approximately 6 to 8% of pregnancies, which translates to about 240,000 cases per year. The rise in obesity is contributing to an increase in GDM cases, making it a growing concern for expectant mothers around the world. GDM not only affects pregnancy but also has long-term health implications. Women who develop gestational diabetes are at a significantly higher risk, between 15% and 60%, of developing type 2 diabetes later in life. Other factors that increase the risk for type 2 diabetes include high blood sugar levels during or after pregnancy, being overweight or obese, GDM diagnosed before 24 weeks of pregnancy. After giving birth, women who had GDM should be tested for diabetes using non-pregnant OGTT, oral glucose tolerance test, criteria 6 to 12 weeks postpartum. If no diabetes is detected at that point, it's recommended that they be retested every 3 years to monitor their risk. Let's now look at the categories that indicate an increased risk of developing diabetes, which also apply to women who had gestational diabetes. 1. Impaired glucose tolerance. IGT blood sugar levels are higher than normal but not high enough to be classified as diabetes. IGT is diagnosed using a 2-hour post-load glucose test, with levels between 140 to 199 mg/dl. 2. Impaired fasting glucose, IFG. This is when fasting blood sugar levels are higher than normal but not yet diabetic. Levels between 100 to 125 mg/dl are typical, though some organizations use 110 mg per deciliter as the threshold. 3. Intermediate hemoglobin A1c. An HbA1c between 5.7% and 6.4% is considered a risk zone. These categories are often referred to as prediabetes, a condition that significantly increases the risk of developing type 2 diabetes and cardiovascular disease. However, it's important to note that there is some debate around prediabetes because different tests, like IGT, IFG, and HbA1c, may not identify the same individuals. There is also no global consensus on the exact cutoff points for these tests. The risk of developing full-blown diabetes increases dramatically for those in the prediabetic range. For example, people with HbA1c levels between 6% and 6.5% are 10 times more likely to develop diabetes than those with lower concentrations. Those with HbA1c between 5.5% and 6% have a 5-year cumulative risk of developing diabetes ranging from 12% to 25%, which is 3 to 8 times higher than the general population. You really don't want to miss our next episode: hormones that regulate blood glucose concentration and counterregulatory hormones, so subscribe, activate notification, and help us by give this video a like and checking our store. Bye.